You can't deny that some dermal fillers can make somebody more striking, more beautiful.
But if a bit of filler is good, then is more better?
If they say, I want to look totally normal, doctor, and you think you've done a good job and they want more.
No matter how big they are, it becomes normal to you, it becomes natural, and that becomes who you are.
Approximately around about 12 to 18 months later, I started to develop bags under my eyes.
I didn't know it at the time, and I was overfilled.
Overfilling. It's a problem that hardly goes unnoticed. Overfilling affects so many people who have fillers. You see it on Instagram, on our friends, the rich, the famous, judges, and even doctors. The truth often goes unspoken, and the overfilled are not told. It's like the story of the Emperor's new clothes.
It took a little child in the audience to point out that the Emperor was in fact wearing no clothes, but everyone else was too scared to say anything.
I see clients who typically have body dysmorphic disorder, who have an obsessive preoccupation with their appearance, and they're extremely distressed about what they look like.
A convenient explanation to why overfilling occurs and why the overfilled don't see it would be that it is simply a psychological issue.
To the outside world, to other people, someone with body dysmorphic disorder looks pretty normal. But for someone with body dysmorphic disorder themselves, they feel like they're terribly ugly, even disfigured. Many people with this problem will seek cosmetic procedures. They don't recognize that the issue that they've got is a psychological one. They think it's an aesthetic issue.
But despite the obvious nature of overfilling, the cause of the problem is more complex and insidious and requires further explanation.
If you overfill, does that mean you have body dysmorphia? So can you be overfilled and not have body dysmorphia?
Yeah, great question. So I think the first really basic thing is, I suppose let's start from the very foundations. People want to look attractive, you know?
Yeah, for sure. And why not?
We're buying lots of products, we're adorning ourselves with beautiful clothes, we're putting makeup on. And when we put makeup on, some women are going for the natural look, but a huge proportion of women are going for a bolder look, something that exaggerates their eyes, blush on their cheeks, high contrast makeup, that doesn't look natural, but still looks really attractive.
Right.
And so this assumption that if someone is getting a cosmetic procedure or having filler done, that they want to look natural, I don't think is a correct assumption.
At this point in the conversation, I started to feel uncomfortable. I've always prided myself on maintaining a natural look for my patients, but Dr. Buchanan was telling me that attractive isn't always natural. Maybe this could explain why it's often been a battle to convince some of my patients that they've had enough filler. Maybe they want to look attractive at the expense of looking natural.
Not everyone's going for a natural look. And there's heaps of studies showing with makeup that people will typically find people who are heavily made up more attractive than people who are lightly made up.
Right.
And the way this is tested is an image of a heavily made up person, someone with light makeup and someone with no makeup is flashed on a computer screen for 250 milliseconds. So this is really, really fast. So fast, you can't sort of think about it. You just see it and then your brain automatically processes it. And what we know is that even when it's flashed up so quickly, most people are saying the person that's heavily made up is the most attractive one.
Interesting.
And this promotion of attractive yet unnatural looking ideals on social media may be driving people to become overfilled. I spoke to my patient about the impact of social media on her self-perception and drive to get more filler.
Scrolling through Instagram multiple times a day and seeing photos, even photos that you don't subscribe to, I guess, just constant photos or ads of mainly influencers or models, and just a lot of people on there, I think, touching up their photos to look a certain way. And in your mind, you don't click straight away that it's not reality, that these people have either touched up their photos or they've had things done, angles, lighting. And for me, at least, I know that was a trigger for how I should look. And if I don't look like that, I'm not worthy. Obviously, that's a very unhealthy thinking pattern. And if you're going on social media with a trigger like that regularly, it's really going to impact your mental health, but also wanting to get whatever you can done to look like these photos that you're seeing. So for me, that was getting filler. I didn't know it at the time, and I was overfilled.
That's quite a powerful message. What sort of impact do you think social media has to play?
I think social media turbocharges
that's a good word for it.
Underlying sense of inferiority that many people have.
Yeah.
Since the invention of mirrors, we've been scrutinising ourselves and had concern about our body image. Yeah. Social media takes that to the next level. With social media filters, it creates this idealised image of people's faces.
But why are people driven to these sometimes extreme ideals?
So I think there's this fundamental psychological idea called supernormal stimuli. Supernormal stimuli essentially means there's particular looks that are supernormal or more than normal. And we know that from the animal kingdom there are studies showing that animals are attracted to other animals with exaggerated features. Right. So peacock feathers is a process of evolution where that peacock has evolved to have this absolutely outlandish look because it's attractive.
Right, so overfilling is like peacocking, sort of.
Exactly, except we're not going to wait around for evolution to do that for us. We're going to use fillers and the technologies that are available to do it.
But unlike other animals, humans quickly tire of these extremes, and what is supernormal quickly becomes normal.
You get filler, you feel fantastic for a week,
yes.
And then your happiness levels just return to normal, because that's just how happiness typically works. And then it's like, all right, well, I felt really great last time I did this, I'll do it again. And then they feel really great for a week, and then happiness just goes back to normal. And then you've got to keep on doing it in order to maintain that level of increased well-being.
I think your appearance is something that you see every day in a mirror. It becomes normal to you, it becomes natural, and that becomes who you are. So you look at them and go, oh, they've gotten a bit small today, I might get a little bit of a top-up.
The patient will come along and you'll inject them. There may be an effect, there may not be an effect. You can quite easily convince the patient that there has been an effect. But the patient may not see that. So they may ask for a little bit more next time because they want to see a difference. Now, even if you've done a really good job and you have rejuvenated them, some patients want to see a difference every time they get up and look in the mirror. And it's amazing how quickly you get used to the new look.
But the problem is that patients very quickly adjust to their new normal and they feel that they need more, and they can't really tell the difference between, you know, striking and slightly odd when they're looking at themselves often.
I've often dissolved overfilled lips, cheeks and tear troughs to bring overfilled patients back to a more normal state. But it's interesting that these patients often demand to have their filler replaced immediately. They can't tolerate having no filler. Conversely, when it comes to overfilling, the patients tolerate it well. They don't realise they have been overfilled if it is done gradually over time.
There's an old story about putting a frog in a pot of warm water and then slowly bringing it up to the boil. And if you do that, then the frog will lie there and slowly boil itself to death. But if you throw a frog into a pot of boiling water, it'll jump out straight away. But this is what we're doing we're bringing people up to temperature slowly and
you don't feel it.
And you don't feel it and you don't notice it.
Because of the acclimation to filling, we can't always rely on our patients to be the best judge of when to fill, how much to fill, or what to fill in their faces.
Most people can't put their finger on exactly what it is that's making them age. They read about things like loss of volume, and they will go along with a specific request. They need more cheek or something. In other words, they're making the diagnosis and they're going along to a practitioner asking for that specific thing.
In most cases of overfilling, it is a specific area of the face that is overfilled, creating disproportion with the rest of the face. Patients are often hyper-focused on a single area of concern, driving them to come in for more filler and often not seeing the big picture.
The problem is you can totally lose perspective. And if you're looking at, if you're looking at something through a straw where you're just narrowly focused, you'll be seeing a totally different thing than if you stand back and look at the whole face.
And the word I like to use is gestalt. It's the effect of the whole.
Some people really, really tune into the details and see sort of one thing at a time. So they'll just look at their eyes, or they'll just look at their nose, or they'll just look at their cheek, or they'll just look at that one wrinkle.
When you look at somebody, it's the whole that you want to look rejuvenated, attractive, beautiful.
But ultimately, fillers are not injected by the patients themselves, and overfilling may occur only when both the doctor and the patient don't see the gestalt.
I think the old adage that a camel is a horse designed by a committee. In other words, you design the back, you design the leg, you design the head, and they put them all together.
You know, we see a lot of practitioners who have quite a limited skill set with what they can do. And if their skill set is cheeks and lips, then they're usually going to recommend cheeks and lips. You can't be what you can't see.
So can we attribute the problem of overfilling to simply inexperience?
I must admit to, being guilty of overfilling patients in my earlier days of injecting. And I remember, injecting many, many mils in one session. And I've certainly come back on that now. But you mentioned an effect.
There's an effect called the Dunning-Kruger effect. Some people very early on think they've got a great gift. And I'm not saying this was you, Gavin, at all. Some people just...
I probably did.
But some people, they get a few good results, and they haven't trained for a long time, they haven't practiced for a long time, but they think suddenly that they're very good at this, when it's a skill that takes years to develop. But because they get a few good results, a few home runs, as they say, they feel pretty good about themselves. And we call this the peak of Mount Stupidity, where you haven't actually learnt anything, you've stumbled across a couple of good results, but then things start to go awry. And some patients, come back complaining, others come back looking weird, and then you suddenly realise you don't know as much as you did.
Yeah.
And then you have to go through the learning phase, the slow learning phase of becoming a very, very good injector, where experience is everything. Now, some people never get out of it. Some people stay at the peak of Mount Stupidity forever.
Yeah. But it might not just be inexperience and an overzealous nature that drives doctors to overfill their patients. Cosmetic doctors may also suffer from body dysmorphic disorder, or BDD, and this has further implications when treating their patients.
About being treated by practitioners with BDD, that they've been found to have greater left-sided brain activity when it comes to processing facial detail, and so they'll have a tendency to focus on areas more than usual.
Does that mean you might feel, for example, more cheeks, too much cheeks or too much lips, just focus on one area? Is that...
Exactly. So they will have this tendency, and we know this from studies in patients, that they'll become very preoccupied with detail rather than seeing the whole.
You might ask at this point, what's the chance of being overtreated by a doctor with a skewed aesthetic perspective? After noticing a large number of practitioners with distorted and overfilled faces at cosmetic conferences, Dr. Harris decided to do a study on the prevalence of body dysmorphic disorder in cosmetic practitioners.
A colleague and friend of mine, Dr. Neetu Johnson, who's a psychiatrist and a practicing cosmetic doctor as well, decided that it would be interesting to look at the causes in practitioners, but in particular body dysmorphic disorders. Overall, we found that the prevalence of body dysmorphic disorder amongst practitioners was higher than that amongst our patients at 16%. And our patients are between 8 and 15%. So we found a significantly higher rate of BDD amongst practitioners.
There is, however, one overriding factor that I believe underpins all overfilling, and that is filler longevity. We've all been led to believe that temporary hyaluronic acid fillers last from 6 to 18 months. However, in January 2021, Dr. Mobin Master published an article in the Plastic and Reconstructive Journal about filler longevity that showed fillers may last a lot longer than we commonly believe. Using MRI scans, he found that of 10 patients who had filler more than 2 years ago, all 10 showed persistence of the filler longer than 2 years, including one lasting 12 years. I spoke with Sally, who put up with overfilled tear troughs for over 4 years because no doctor believed that her filler would last that long.
Approximately 2016, I had some, tear trough fillers done. And at the time, it looked great, walked out, everything was fine. Approximately around about 12 to 18 months later, I started to develop bags under my eyes. So that was now about 4 years ago. I actually work in an eye clinic.
Right.
And we have surgeons that operate on eyes, and I got told, no, we can't help you. The only thing we can do is we can give you an incision here. They're festoons. They're not eye bags, they're festoons. And I'm like, oh, what are they? Go home and I do some Google, this, that, the other. And so I went to 2 oculoplastic surgeons, 2 ophthalmic surgeons, 1 plastic surgeon who told me that I had to have half a facelift where he would post my cheeks here, put 2 pins here, cut here, lift up the eyelids, and I was just like, I was horrified.
I've seen about 100 scans in the last few years that are dedicated facial MRIs, and I've found that this longevity issue seems to be going in the direction of around the troughs and
eyes,
in the cheeks.
I had read your story, Gavin. This is the problem. I had this knowledge, and I had even said to these people, is this filler?
So this has to be understood that if a patient comes to you and says, I believe this is filler, you need to believe the patient. So many patients have come to me and said, I've gone to, we're talking experts, excellent experts in whatever area, specialists, and they don't believe me. And I do an MR and it's full.
According to everybody, filler dissolves in 12 to 18 months. And you have a very hard time telling a doctor, is this filler? And I even gave the story that you gave me to 1 oculoplastics doctor. He looked at it, he sent me for the MRI, and he goes, you do have something in there.
She was a good example. She moved a little bit in the scanner, but we still have a decent image here, which is called an axial T2 fat sat. So fat sat means it's saturated fat. Fat is all black. We've gotten rid of all the fat so we can see fluid. And it's a slice like this, straight across here. Just underneath the eyes, it's literally right here is that slice. And you can see on the right side, we've marked the filler. The bright stuff is superficial, and then there's some bright stuff deep.
If filler lasts a lot longer than we expect, then the regular top-ups may be more frequent than required. Lips, for example, are commonly injected with 1 ml of filler every 6 months. But if filler lasts significantly longer than the interval between injections, an accumulation of filler and overfilling might occur.
The first time I got my lips done was probably about 2016, so 5 or 6 years ago now. So I always had 1 mil done, just in my lips every time I went, top and bottom, and that I've probably had them done around about 5 or 6 times.
Were you given an expectation as to how long they might last?
So I was always told that, people get top up to every 6 months to a year and things like that. So whether that was, just promoting, obviously, to come back and come back and come back.
So this is the outer slice. You can see it's a coronal. It's a cut like this, and you can see the lips, the bright stuff. And then the second slice, that is closer to the front, so you get more of the medial, the inner lip. The bottom lip seems to have a pretty consistent amount of filler in there. And then the top lip, you can see there's also still some integrated looking, filler in that area. Side on, if you have a look at her images, in the middle, there doesn't seem to be much there at all. But I guess we don't really inject in the middle too often.
No.
And then slightly to the side, you can actually see a little bit up the top, and there's a little bit more down the bottom. So there was still some residue from, 5 years now?
Given the potential of filler to last a long time, as practitioners, we have to be able to carefully assess patients before filling and say no if required.
And a lot of practitioners are scared to say no because they think they'll lose the business.
And she said, I think, it might be best off dissolving. She was more than happy to inject the filler into my lips that day.
Right.
But she said, I think even just your top lip, we might have to dissolve it a little bit.
So she said to dissolve it, but you didn't?
But I didn't know.
What happened?
I ended up getting more filler.
Yeah, I'm getting more.
The patient can be their own worst enemy in this stage. They say, I want to look totally normal, doctor. And then you come back and you think you've done a good job and they want more. And it's your job then to say, stop. This is what you wanted and this is what I wanted and you look great.
After having seen the accumulation of filler radiologically on MRI, Dr. Master suggests occasionally dissolving filler if required to prevent overfilling.
You made an analogy to me, actually. I really liked it, about the clay model.
It's a sculpture. You create a sculpture and you have putty, for example, or clay, and you put all the putty on, you put on the cheeks, etc. But over time, you can't keep adding that putty on there because it becomes bigger and bigger and bigger. So you have to carve and you have to chisel away to put it back to a normal looking face.
But why should those who spend their hard-earned money on fillers dissolve them, especially if the underlying motivation may be to stand out?
So overfilling is like peacocking.
In the same study mentioned previously about heavily made up faces being more attractive when flashed for 250 milliseconds, a different result was shown when given an unlimited inspection time. Inferences were then made about trustworthiness, authenticity and genuineness, detracting from the increase in attractiveness afforded by the high contrast makeup.
When you show that image for longer, people still agree that the heavily made up one is most attractive. But then there's this other process that happens in the mind where we say, wait a minute, why do they have so much makeup on? Are they less authentic? Are they making up for something? And so I think when it comes to overfilling, the same process occurs.
Steve Dane's a plastic surgeon from Chicago who wrote an article with a couple of his colleagues about beauty or attractiveness overall. And he was looking, why do we do these things? And we think the patient looks better, but they don't actually look rejuvenated. They look a bit different. They look a bit strange. We're not quite happy with it, but they look better than they did beforehand. But we haven't brought them to the place we want. And the problem is that they don't look genuine anymore.
You know, one of my favourite phrases is that it's better to look old than odd. And, you know, most people agree with that. They don't want to look odd and they're very scared of looking done.
Reducing the use of social media and our exposure to unrealistic ideals may also help reduce our drive to be overfilled to more extreme levels.
So I've stopped going on Instagram, and ever since I have, pretty much immediately, I would say within that week, it's just that those triggers really slowed down. And so I'm not having that constant trigger of seeing these images and being triggered to make an appointment. Immediately I've got to make an appointment with so-and-so to get this done, to look like this.
So the research is really clear on social media. If you spend more than about 20 minutes on social media a day, your level of overall satisfaction with your life and your appearance will go down.
Right. Wow.
So up to 20 minutes, it's fine, it's good, you're staying socially connected, you're staying informed. If you're spending more than 20 minutes a day on social media, it's bad news.
Sally, who was a victim of the long-standing belief that filler only lasts months rather than years, eventually got her tear trough filler dissolved and was fixed overnight after waiting 4 years and seeing more than 5 specialists who told her that she needed surgery to remove the bags under her eyes. Emily actually was very open about her situation, coming on national TV with me to have her lips dissolved. Afterwards, I brought her back to the clinic to have 1 ml of filler, which is about the same amount she'd usually have injected into just her lips, distributed around the face to improve balance and proportion. To prevent overfilling, practitioners need to more carefully consider using smaller amounts of filler and looking at the face as a whole, rather than just filling the same areas repeatedly. Like the uncanny valley, it's not that we are unable to see overfilling, but instead we choose not to see or don't see it. But overfilling certainly has psychological implications as the overfilled keep on filling and overfilling becomes the norm. I hope this video helps to reduce the incidence of overfilling by bringing awareness to the topic and why it occurs. Let's not promote the overfilling standard by keeping quiet about it. As I always like to say, if you can tell something's been done, it's not a good job.
This is a 69 years old lady. She had 2 previous facelift surgeries. They took too much of the fat from the buccal area, too much skin from the eye area, and it's drooping downward. So I had to do a tertiary or 3rd time around facelift for her to lift up the muscles of the face and neck area to give her better definition, fill up the hollowness in the cheeks and the malar area with fat and PRP, and to improve the overall skin laxity and wrinkles.